I'm Shannon Muse. I'm a registered dietitian and licensed dietitian nutritionist. When we think about nutrition for older adults, we don't often think of hydration. As we age, we tend to have less lean mass than fat mass, and muscle mass holds more water. Body fat has a lower water content. Therefore, as we age and increase in body fat, our hydration status declines. We also lose some of our sense of thirst as we age. Sense comes from the hypothalamus, and it just decreases in sensitivity over the aging process. The signs of dehydration can include being tired, weak, muscle cramps, confusion, trouble walking, increased heart rate, decreased blood pressure, fainting, increased rate of breathing, sunken eyes, dry mouth, less sweating, and having dry skin. It is important to encourage fluid intake in older adults, explain the importance of it, and then set goals with them for fluid intake. For example, drink 8 to 16 ounces of water first thing in the morning before brushing your teeth. Serve 8 ounces of water with every meal, considering you want to have 3 meals. And then serve 8 ounces of water with each snack, considering you want to have 2 snacks a day. And then drink 8 ounces of water an hour before bed. That totals up to be 8 glasses per day, to equal 64 ounces a day. I think the key is to break it up into measurable amounts. It's hard to chug water when you're older, so finding ways to get it in during the day is key. If they wake up in the middle of the night, water only should be the rule. Oftentimes, drinking through a straw can be easier to drink and swallow as well. Or you could find a cool cup that they like that has a straw and fill it with fresh water multiple times throughout the day. Find out if they prefer ice or no ice. Don't assume that they like what you like. You know the saying, you are what you eat? Well, nutrition fuels our body, and when you eat well, you feel well. For those living with Alzheimer's or dementia, nutrition plays an important role in helping to prevent further cognitive decline. The best diet for Alzheimer or dementia is the MIND diet. The MIND part stands for Mediterranean and DASH diets combined, and it's an intervention for neurodegenerative delay. If you're not familiar with the DASH diet, DASH stands for Dietary Approaches to Stopping Hypertension. So these two diets combined, they focus on plant-based foods linked to dementia prevention. It encourages eating from 10 healthy food groups. Leafy green vegetables, at least 6 servings per week. Other vegetables, at least 1 serving per day. Berries, at least 2 servings per week. Whole grains, at least 3 servings per day, and fish, 1 or more servings per week, and then poultry, 2 servings per week, and beans and legumes, 3 servings per week, nuts and seeds, 5 servings per week, and wine, 1 glass a day, but not more, and olive oil. The MIND diet limits servings of high-fat meats and sweets and cheese and butter and margarine. It limits fast food and fried foods. The top nutrients these foods cover include fiber, potassium, magnesium, vitamin B12, omega-3 fatty acids, just to name a few. You may want to supplement with vitamin D and calcium in addition to this diet. Some foods to consume to get these nutrients include: for fiber, lower carb vegetables like spinach, broccoli, cauliflower, carrots. For potassium, milk, potatoes, oranges, or orange juice. For calcium, milk, yogurt, cottage cheese. For magnesium, beans and legumes, sunflower seeds, leafy greens, and whole grains. And for omega-3 fatty acids, fatty fish like salmon and tuna, and healthy fats like olive oil. So vitamin D, we get it from the sunshine in the summer months, and this often needs to be supplemented in the winter months. talk with your physician about how much you should take or get your vitamin D levels measured. So if you're wondering, am I going to feel better if I eat this diet? In my opinion, anytime you eat healthier, you're going to feel better. And back to our old saying, you are what you eat. So if you eat well, you're going to feel well. If you're considering starting this diet, think about how you can make it sustainable. Make small changes, like pick one goal each week to incorporate, and then build it from there. Make this new way of eating really a sustainable, lifelong change. What will help you stick to it? I think allow yourself some small, reasonable treats each week if you need to. Malnutrition, simply stated, is not having enough to eat or not eating enough of the right foods. Malnutrition is more common in older U.S. adults due to the variables that affect their ability to get proper nutrient intake. Number 1, older adults are more likely to have poor oral health as they age. For example, missing teeth, ill-fitting dentures, infections. All of these affect how much they will eat and what they can eat. Number 2, cognitive impairment. Older adults may have problems remembering when they last ate or troubles communicating what they need help with in order to eat properly. And number 3, an overly strict diet for their chronic disease state and lack of understanding how to implement this diet. For example, if a person has hypertension, diabetes, cholesterol, and they don't know what to eat, or they have so many guidelines to follow that they end up eating almost nothing. This is where a dietitian is key. Number 4, if they're on lots of medications affecting their appetite or mood. And number 5, depression. They just don't feel like eating. The top nutrient deficiencies in the aging population are fiber, potassium, calcium, magnesium, and vitamin D. The signs of malnutrition are being tired, depressed, confused, muscle wasting, unplanned weight loss. Here are some tips to help your older adult get these key nutrients. At each meal, have 3 to 5 food groups. For example, for breakfast, have a fruit and a whole grain and a protein. For lunch, have a serving of vegetables, for example, a lettuce salad or spinach or a cup of broccoli or cauliflower. Have that at least once a day, and then have a serving of protein like salmon or tuna or a black bean burger, and then have a whole grain roll next to it with a little olive oil for dipping. For dinner, you could do the 3 food groups or even up to 5. Try to include a glass of milk at least once a day. And a rule of thumb for snacks is to have at least 2 food groups. For example, a piece of fruit with some peanut butter. Some things that you can do if your loved one is showing signs of malnutrition: take steps to help them improve their food intake. Help them plan their meals. Help them shop. Eat some meals with them, helping them to get 3 nutrient-rich foods at each meal. Don't get caught up in the fact that it all has to be fresh fruits and veggies if they can't eat them. Canned fruit is okay. Put butter on veggies to make them taste good, for example. Go with them to their doctor. Talk with the nurse and the doctor about the signs and symptoms you're seeing. Verbalize willingness to follow guidance for how to improve your loved one's health. Ask for a referral to a dietitian and a community resource if they know of any. Be persistent in seeking out the help that you need, but be kind and patient with the healthcare system that we are all in. So why is nutrition so important for older adults? Well, what we eat makes such an impact on every part of our bodies. Our brains and how well our brain functions, our digestive tract or our gut health, which in turn affects our immune system and digestion, metabolism, and ability to utilize the nutrients that we eat. Our bone density, which affects our teeth, our strength in our legs and feet, and ability to walk and move. So if you're wondering, well, what do I do next? My advice, don't wait. You might be stuck in some pre-contemplation mode or have fears of change or what people would think of you, but make your health a priority. And don't wait. Reach out for help. Whether it be from a friend or a relative or an expert, you are important enough to take action today.